This is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me on the program today is Dr. Pedro Lewis, the Director of the National Blood Transfusion Services. Welcome to the program, Dr. Pedro.
Thanks for having me.
So with World Blood Donors Day approaching, and I know PAHO is celebrating 20 years of celebrating this day, tell us, what does this day means for Guyana and even the countries globally?
Yeah, great question. So in 2005, of course, the World Health Assembly met and they passed a resolution indicating that June the 14th of every year, we should put aside that particular day to celebrate World Blood Donors Day. So this year marked 20 years of giving or generosity, and we're here this year again to say thank you, donors. So in Guyana, of course, no exception is given beside other countries in the world. We put aside this day to give thanks to all our donors, especially our voluntary donors. We have celebrated years and years of 100% voluntary donors. These are persons that comes into the blood bank, give 15 minutes of their time on a daily basis to just give life. We know one unit could save 3 lives.
Yes.
And we celebrate those individuals.
Thank you so much, Dr. Pedro. Could you tell us about the importance of blood donation? And we know that one unit save up to 3 lives. But for those persons who are watching and listening to the program, could you tell us what is the importance of this day? Not just the day, but of blood donation.
Okay, so all blood is being utilized in Guyana. I mean, we could look at it at 2 angles. Look at it as patients that need blood like yesterday. And here we're speaking about trauma cases. Here we're speaking about obstetric patients. These are the pregnant mothers who comes in the hospital with, postpartum hemorrhages, persons with, for example, ruptured uterus, and so on, that could bleed if they don't get blood like yesterday. Those individuals, of course, must be given priorities in terms of blood transfusion, and we must assist the doctors in that manner so that, we could save a mother. And we know most of the time these mothers have, 5, 6 children, and they're part of a family, and of course, if those mothers was to pass, of course, the family become, dysfunctional. So it's very important that we support these type of patients, and we give the doctors a lot of time, to stop the bleeding. And then we deal with other patients, as the chronic anemia patients. And these patients, they want to feel part of society, they want to go to school, they want to earn a living. And here we're speaking about the chronic disease patients, we're speaking about the thalassemia patients, the sickle cell patients who may come to the hospital on a monthly basis or every 2 months to receive blood transfusion so that they could get this energy and the strength, to continue to go to school or continue to work to earn a living.
Thank you, Dr. Pedro. We'll be right back with more on blood donation.
Give blood, save lives. One unit can breathe life, make someone smile. Donate blood and heal a life today. Give blood, save lives. You just have to give and save. Save lives. A message from the National Blood Transfusion Services. Be a good Samaritan, be a hero. Donate blood, save lives. For more information, contact us on 223-7182 or 226-9022.
Welcome back. Dr. Pedro, could you tell us about some of your achievements within the last year? I know the National Blood Transfusion Services, you guys have been doing a lot of work out there, a lot of field work especially. Tell us about what has been going on.
Yeah, this is a great question because a lot of times, the blood bank, lab in the whole, we be working at the back. Very frequently, we at the back, we working. Um, and, person don't really notice us, we working at the back. But, of course, when we're speaking about blood transfusion, like I mentioned before, um, maternal mothers, um, at this age and age, it's very difficult to lose somebody because of the lack of blood. And I must say, we contributed a lot as it relates to reducing maternal deaths by bleeding. So if you go around the country, you will see we have blood stored in places like Morocco, Maburumo. Um, Very soon we store blood in Port Kaitumo. We have blood in Maikoni Hospital. So when somebody bleeding, you don't have time. So the closer you could get safe blood to those individuals is better for them. You give them, a better chance of making it. You give the doctors um, a lot of time so that they could stop the bleeding. When we have those patients, trauma patients, like I mentioned before, and obstetric patients. And not only red blood cells, a lot of person, when we're talking about blood transfusion, everybody's thinking about red blood cells. But what is very important too is the clotting factors, the proteins, and so on. And this is the reason why we put a lot of energy, we put a lot of funding in storing plasma in these areas too. Right? So not only blood is being stored in these areas, plasma, because bleeding, a person could go into DIC within minutes if they don't have all the components present. So it's very important that you have plasma there, you have cryoprecipitate to assist in the coagulation process during bleeding.
Definitely, thank you. About the blood donation process, tell us how that is done for persons who are considering becoming a voluntary blood donor.
Yeah, so of course, blood donation is very simple. Very simple. As long as you age 16 with parental consent, and you could donate up to age 65. You could go farther than 65, of course, with advice from your doctor. You come into the blood bank, or you could visit any one of our collection sites. Of course, we locate in the region 2, region 3, we're in region 10, in region 9, right? In other areas like region 7, you could listen out for us because we go to those regions like 3 times a year. So we broadcast it before we go to those regions where we don't have collection site. We go as far as Morocco, we go Cameroon and those locations to collect blood. We make sure that we go like 3 times a year. We give everybody opportunity to donate blood. It's simple. So nobody won't say, you never get the opportunity to do so.
Yes.
So as long as you 50 kg or 110 pounds and over, you could be a donor. The other criteria where we may ask you questions, we not ask you these questions because we want to mind your business, but at the end of the day, our objective to get safe blood to the patient. Patient could be anybody relative. So it's very important that, you be honest when you answer questions. A few questions. So within 15 minutes, you could be in and out from our collection site or on a blood drive.
You mentioned safe blood, and I want to ask, how is the blood stored? Once persons would have donated, how is storage done?
So this is very important because we fractionate 100% of our blood units. Fractionation means that when you get the whole blood, of course, we separate it into components, where cell, plasma, platelets, cryoprecipitate. And each one of these components is being stored differently. This is the reason why we fractionate, so that you could get optimum usage of the unit that you donated. So, of course, the plasma is being stored at at least a minus 18 degrees C. We have special freezers where we store those plasma, and cryoprecipitate red cell stored at a higher temperature between 1 to 6 degrees C. And platelets, of course, stored between 20 to 24 degrees C. And that usually bring a little bit of problem because the expiry date of platelets is just 5 days. So those components, of course, stored at different temperature. It's being stored differently. That's why we fractionate. So all of that is part of, all of that contribute towards safe donation. And of course, screening the donors is very important, and also testing is important, where we qualify our product by testing.
Dr. Pedro, earlier on you would have mentioned some of the persons that benefit from blood transfusion, persons such as persons in maternity, accident victims. Tell us a little bit more about some of those patients that you guys would encounter on a daily basis and even a monthly basis.
Yeah, great question. So in the hospitals, of course, and this depends on, the specialty and so on. So I mentioned before some cases like we need blood like yesterday. And it's very important to note that, especially when you're dealing with the chronic anemia patients, our first option should never be blood, right? A blood transfusion depends on the patients, because remember, you're transfusing a patient, right? You're not transfusing what hemoglobin level the patient comes in with. So we must, at any opportunity that we get, we must at least explore alternative measures to transfusion. So we have medication that we could use. For example, patients who suffer from kidney issues, we know for a fact that the issue with those patients is the stimulation of the bone marrow, which, erythropoietin does that, and erythropoietin, of course, is being stored in the kidney. But of course, we got erythropoietin medication that is being sold in the market. So we got to make sure that we explore alternative measures. We got iron, hematinics, that is being sold in the market that, patient could be used, the doctor could order it. We got to make sure that it's in the hospitals, in the pharmacy, and it's something that we're working on. If you go to many pharmacy around our country, you will see there's erythropoietin there that will cover the amount of kidney failure patients that is in the region. That's very important. Moving forward, to be looking at persons who probably may not want transfusion for various reasons, right? Whether it be, religious reason, or whether you're scared of, be in contact with the infectious marker, or whether based on the situation where you're at your blood type, you might have a rare blood type, or whether the case may be. We're exploring measures of autotransfusion or cell salvage. Of course, these are patients that will be in surgery and, they start bleeding and so on. So with that build a balance, equilibrium between allogenic transfusion and, of course, blood collection, right? Because we want to save our blood for cases like we may have now on a monthly basis, heart surgeries. We have baby heart surgeries. We have adults that usually do surgeries every month on a monthly basis. And, if these patients bleed, they utilize a large amount of blood units. There's allogenic transfusion. So we also explored, we don't get a lot of requests for this, but autologous blood transfusion, where a person could donate the blood before surgeries. And most times this will happen in case of spinal surgeries, some of the orthopedic surgeries, where a person could donate the blood at least 72 hours before the operation, and their blood is there. In case they need it, they could have it, right? So these are measures that is being put in place so as to save allogenic transfusion, to save, blood collecting in the blood bank in cases where, we have accidents, like I mentioned before, and obstetric patients where they must have the blood like yesterday. So we must bring an equilibrium into that.
Yes.
And this is something that we're working on in the regions and, of course, at the Georgetown Public Hospital Corporation.
Tell us about the importance of family support, even through the period of a blood transfusion. How important is the family, even as a patient go through that?
Yeah, so it's a great question, because most times, patient goes into the hospital. When you speak about family support, most of the time people may think, the family must donate for those individuals. And very importantly, like I mentioned before, we at the National Blood Transfusion Service, we look at voluntary blood donation. Why? Because that's a safe route to go at, and it guarantees availability. What the family should do, and we encourage that, most of the times these patients are part of an organization, a church, a mosque, temple. They're part of an organization. And we would rather the organization, to comfort, do a blood drive, right? In that case, it releases the anxiety on the near relatives. And we don't want that, right? We're not in a position to, we're never in a position to force a relative to come and donate every time it's, that child needs blood. But it's very important because, of course, we don't get blood from nowhere else other than human being. They reach out to the community, the family reach out to the community. There must be an organization there that could help. And we partner with, more than 400 organizations in Guyana, in the various regions. Of course, we do community collection also. And I think this is the way it should be.
A collaborative effort.
A collaborative effort with the community, the church, and they should reach out to us at the blood bank. And you keep a blood drive, every 3 months, just every 3 months. Like I mentioned before, the process is very simple, right? It's low cost, right? You don't have to find the chairs, you don't have to find the blood bags. The Ministry of Health, provide all of those things. The blood bank come with our chairs, we come with our staff to do the extraction, and of course, you get a free vitamin provided by Bank ZIH. We must thank them for that. So every donor receives something to drink and so on. It's simple, right? And you probably not helping that one child in the community. Probably you helping so many persons in the community, but you don't know. And like I, keep mentioning, there's so many body that comes into the hospital, they receive blood, and nobody knows. They don't know who they get the blood from. But of course, is a donor who give 15 minutes of their time, comes in, and they donate blood for a particular individual. They don't know who the blood goes to, right? And the person who receives don't know where it comes from. So, I mean, it's sometimes it's good to, give back.
Be a good Samaritan.
Yeah, in the community.
And to, we want persons to understand that you don't have to know somebody that needs blood to collaborate with the National Blood Transfusion Services for a blood drive. It can be something that you just want to do, something that can give back to others as well.
Yeah, and I keep saying too is that, if you're part of an organization, I think this is one of the simple gesture that you could do. You just put it in your yearly calendar. We decide that we're gonna do it on probably Youth Week, one of those weeks during the year. Make sure it be 3 times a year, and you place it, on your calendar. And we're gonna do this for a year, a blood drive. It's very cheap to pull off. One activity is very cheap to pull off. It don't take up much of your time, and you put it there, and And like you said, you don't have to know anybody. Sometimes you may be donating the blood for yourself. You don't know, right? So many accidents now that
Yes.
we having. Those persons usually require a lot of blood for repairs, fracture injuries, a lot of blood.
Thank you, Dr. Pedro. We're going to go into a short break and be right back.
In 10 minutes, you could save 3 lives with just 1 unit of blood. Here's how. Each unit you donate is divided into the 3 components: red blood cells, plasma, and platelets. Each of these components have different uses too, treating different diseases, car accidents and burn victims, trauma patients, open heart surgeries, and so much more. Car accident victims and organ transplants require at least 50 units of blood. Burn victims need at least 20 units. Open heart surgeries require at least 10 units of blood. It starts with you and 1 single unit. So let's join in making the world a better place. 1 pint at a time, 1 life at a time.
So, Dr. Pedro, with World Blood Donors Day approaching, what can persons look forward to this year?
So our usual, activity, of course, is to give gratitude, say thanks to the donors. Of course, we not be able to give everybody, all the donors. We try to rotate it every year, something on that day. But of course, this year we'll be at the Marian's Academy school, private school. That school usually keep blood drives with us on a yearly basis in February, and they contribute every year, over 300 units of blood. And every year we try to rotate. Last year we was at Banks IH that usually contribute blood drive, and of course they contribute towards the Vitamat. So last year we were there, and this year we will be at the Marines Academy, and we want to celebrate it with the children there. And I think this is very important because the Marines Academy, usually not the children basically donate blood on their blood drive, but it shows how good ambassadors they are on a yearly basis. They recruit donors, their parents, family, friends from the community to come and donate. And they usually do it on a Saturday. They take the entire day on a Saturday and they give back. And because of that, we want to recognize from the base of the school to the various sports or voluntary donors across Guyana, and just to say thanks on that day.
Do you have any final words of encouragement to our listening and viewing audience before we wrap up today's program?
Yes, of course. I always want to use this opportunity to say thanks to the voluntary donors. You guys should take, at least a glass of wine, celebrate. In whatever small way you could celebrate. And don't forget, to always return to the blood bank. We always need voluntary donors. We always need donors to the blood bank. All groups are important for us. Remember, this is the only way we could access safe blood, right? We can't get it from nowhere else. We can't purchase it. It's our voluntary donors. And I just want to encourage you to, visit our site, Region 2, Surrey Hospital, Region 3, West Demerara Hospital, Region 9 at Gatem Hospital there, Region 10 at Linden Hospital Complex, and of course you could come central. We're in Georgetown Public Hospital, Rama Street. So we encourage you to keep on giving, keep on coming, and save lives. Thank you.
Dr. Pedro, keep up the good work that you guys have been doing at the National Blood Transfusion Services. Thank you for staying tuned with us. Remember, 1 unit of blood can save up to 3 lives. So this World Blood Donors Day, I urge you to come down to the National Blood Transfusion Service and donate blood. I'm Alicia Martin saying goodbye for now.